to know is how we can support you. So you can either scan the QR code, or what I'm going to be doing is I'm going to share a link in the chat, and you can also click on the link to fill out the form. So I'm going to go ahead and share this in the chat right now. Yeah, I'm just going to wait again a couple more minutes. Amazing. I think we can slowly get started. Yeah, I hope you can access as well the link in the chat. Yeah, as I said, this is just a great opportunity for you to share what kind of support and help you need from us. And you'll also have the option to leave in your email, for instance, in the form, so we can reach out to you afterwards and give you a bit more bespoke advice as well. So I'm not sure if I can pin these in the chat. Probably. Yeah, amazing. So you should be able to see the form at the top of the chat. Amazing. I think we can get started. So basically what you have over here is just a reminder of where you can go ahead and get some support and training after today's session. So if you cannot stay until the end, for instance, please don't hesitate to reach out to myself or my team or our support team by first going to, I would say, any of the Accurx website pages, and you can start a live chat with our lovely support team. And that's quite helpful if you have any urgent queries and if you are also experiencing any technical issues. So you can also email the support team at support@accurx.com. You can reach out to myself and my team for any training queries or product questions. For instance, if you don't know how to use any of the features over here, you can reach out to customer.success@accurx.com. And also, if you don't have any of the things I'm going to be mentioning today, that mainly will be patient triage. If you don't have access to that feature, what you can do is reach out to our partnerships team at partnerships@accurx.com. So what I'm going to be doing now is quickly introduce the session. I've already spoken a little bit about why we've put this session together and what you can get out of this session, which is mainly a refresher on how patient triage works. But as I said, we do have two special guests with us here today, and we're going to get started with that. As you can see here, the second session. So the second option, I say segment of today's session is on insights on implementing a triage solution. So we're going to go more into that in a few moments. And after that, what I'm going to be doing is a live demo on how you can go ahead and use this. So how it looks like for patients submitting a request on the online form and how it looks like to your practice once it comes through your Accurx inbox. And we'll end the session with a Q&A as well. I'm going to slowly get started by introducing you to our first special guest here today, which is Dr. Zara Gandon from Mayfield Surgery. Not sure if you can hear me, Zara, if you're already here.
I'm here.
Amazing, amazing. Welcome, Zara. So as you can see here in the slides, Zara has implemented Total Triage in March 2023, which is 2 years ago, which is crazy. And she is more than happy to speak today about her experience with implementing the patient triage solution and Total Triage. I think I'm going to let you introduce yourself first, Zara, if that's okay.
Yeah, hi everyone. Great to be with you today. As Marlene said, we decided we'd go for a trial before the government started suggesting things of total triage because our receptionists were just going crazy, and on call you were just always seeing the wrong things. And so we decided as a trial, we tried patient triage in March 23. Within a week, we realised it was something that we weren't going to keep doing long term, and it has revolutionised how we work as a staff team and the impact on our patients. Our Google reviews, everything's so much better. So yeah, jump in.
Amazing. So yeah, that's really good because like basically you were explaining what were the key drivers for you to implement patient triage. I was wondering what were the initial steps that you yourself and your practice took when you decided to implement these digital solution?
So to start with, it was just a lot of groundwork of working with our staff, explaining how it happened. We redesigned our, I think, had 3 days out. Accurx have loads more resources now than they did then. 3 days out of clinic, redesigned the appointment system, and then we had a month. Did training with our receptionists, bought them lunch, taught them through it, and then we had a month lead up of leaflets. We didn't have a PPG at the time. We would have involved them if we had. We do now. Leaflets. We changed all our phone system messages, and we prepared people for launch day.
Wow, it seems like so simple looking back right now, but I'm sure that has been like a lot of work as well. So, just to confirm, you said the first thing that you looked at was your appointments book,
Yeah,
and
so
that's the
we
first thing you
changed.
redesigned.
We changed our appointment book. So we do triage by we have 2 week pre-bookables, 1 week pre-bookables, 48 hours, 24 hours, and book on the days. And so we reorganized because before that there was some follow-up slots, and we also have follow-up slots. But now we triage people into each of those. So they'll get a preset template text message with a self-booking link for any of the pre-bookable appointments. If they're having an appointment on the day, and we skew our clinics, so more book on the days or in the afternoon than the morning, so that the triaging clinician can have a time to go through. All the book on the day appointments are assigned by us. Everything else is a self-book link, or if the patient has said, there's digital issues, then reception will ring them, and we will just assign the task to reception with the category of appointment we'd like to book them into.
Okay, wow, that seems quite smooth. I do feel like you have a specific process in place as well, and you've designed all of that before you went live, or I'm
Yeah,
imagining that you're going to be adjusting, of course, as you go live, but you had to think about all of that before going live as well, right?
yeah, we did that all before going live and explained it to patients as well and took them on the journey. And we're quite a deprived area, quite digitally illiterate. But our phone wait is now less than 90 seconds, and the phone lines are often
Wow.
dead. So people's relatives love it because they fill in the form on behalf of their parent or their aunt or uncle while
Mm.
they're trying to get out for work as well. So we have it open from 8 till 3, and we'll obviously have to think about this come October if this part of the contract does change. But after 3 o'clock, it's reception flow only.
Okay, amazing. And yeah, for those who are not familiar with reception flow, I'm more than happy to explain that as well later. But it's basically a tool that enables your receptionist team to submit a request on behalf of patients. Yeah, and yeah, it all seems quite smooth looking back, but also a lot of work. So I mean, you've been doing this for 2 years now, so I'm sure you can see like the benefits of all of that work. Before like I ask you the question about benefits, because I have lots of questions around that. I was also wondering how long did it take you to implement all of that?
As I said, I had 3 days out of clinic
Mm,
to do it, and then we did a month lead up with the patients. We've done some altering of clinics since then in
mm,
terms of to begin with, we didn't skew the clinics towards we had the same amount of book on the days in the morning as in the afternoon. And we
okay.
changed that because we realized that the triaging doctor didn't have enough time to get through things. So that's something we've changed. And we've also just changed the ratio of some of our appointments. So we've decreased the amount of 2 week pre-bookals and things like that. But we actually haven't needed to do much more adjustment than that. It just works really well.
Amazing. That sounds like great. And I was also wondering, like, because it seems like it was quite smooth, both for your team, and your patients. But I was wondering if actually if you had some resistance from the patients, especially as you said, you do the work leading up to the change with the patients. But I imagine that there might have been also some work to get buy-in from the people at your practice as well, your staff.
Yes, so we did a lot of questionnaires with so we're a partnership-led practice. I'm one of the partners.
Mm,
So as partners, we did the first week of triage ourselves. We didn't want to put our staff in line for something that wasn't going to work. We wanted to be the
mm,
ones that did the rough work first. And we did well-being questionnaires with our reception team. We're fully aware something had to happen to change, but we're resistant to the change. But we had meeting the first week that we did it. This is a good time of year because as winter starts to tail off and your demand drops a bit more. But I
mm.
prepared all our staff that when we started, it was going to be hell, because you're suddenly going to become aware of your unmet need. So that really helped when it wasn't, because I just kept drilling home. This is going to not be great to start with as we find out our unmet need from all the
Yeah.
people at 8 o'clock who couldn't get through. But very quickly, we two receptionists have left for various reasons, and we haven't had to replace them.
Wow.
So it has, and our main receptionist, I do the ambassador sessions, and I got our lead receptionist to give me a quote. And suddenly our receptionist started making us cups of tea because their job just really changed. We did a whole social media campaign. We did leaflets in the practice, stuff on our Envisage screen. We did get real resistance in the idea of it from the patients. I even had a death threat online from a
Oh,
patient.
wow.
But it just didn't materialize into anything. When they realized actually they had better access than they did before, um, things changed. So
Oh,
I mean, we got 96% good or very good on our patient satisfaction. Our Google reviews have gone up. Our NHS Choices reviews have gone up all since we've done this.
wow.
Um, so yeah, and our staff were much happier.
Yeah, that definitely. I'm just thinking like those are two big benefits. Like, and also what you're saying, the fact that there was a lot of resistance from patients. Like, I'd say, like, how long did that, like, yeah, how long did that last? I imagine at least like a couple of weeks to begin with.
Yeah, I mean, we did a lot of we had an open afternoon as well. So we invited patients to come in and we teach them how to do that, how to do the online triage. I think when they
Oh,
realized they didn't need a username and password, that really helped. Um, and also that if they can't do it, they know that reception will do it for them.
mhm.
We have paper versions at reception as well. So for the patients that walk in off the street, they can fill in a paper version of the form as well.
Oh, this is great. So basically, you were saying to them, you're not decreasing your access. You just,
We're increasing
again,
our access
yeah.
actually.
So I feel like, sorry, excuse me. I feel like that's like something that's really important, even for myself as a patient, of course, but something to like keep in mind when changing to an online consultation feature like this one, that you need to make sure you're communicating that with patients, that you're doing this to benefit both them as patients, but also the practice and find better ways of working. Yeah, I
There's
was
a
just
there's a
wondering.
question on the chat,
Yes.
I can just see about how did we encourage the reluctant patients? And we still have cohorts that can't do it. Interestingly, sometimes it's our 20-year-olds who really kick off and our 90-year-olds do it. So it's not always age related, as to who will and won't do it. We still get the phone calls from a mobile number saying I've got no internet. Of course we do. But we just say we use Surgery Connect for our phone line. So if you ring in, you can get sent a direct text message with a direct link. So that has helped. And I think patients, if they really can't do it, then reception will do it. That's not a problem. I think it's just sometimes it's reassuring patients, or often our reception team are really good at being like, you give it a try. If the triage isn't here in 5 minutes, I'll ring you. and then they ring them. And so there's just that sense of they know that we will ring them. But reception flow, I think we're about 80% is filled in by the patient, 15% is done by reception, and then the last 5% does come in via the NHS app.
Wow. Yeah, I was also wondering because actually there's already two questions, one in the Q&A, about what happens if there's no appointments, and the other one is what happens to any urgent requests that come after 3 p.m.
So our we do actually set a cap as well, because we want to ensure safety our end. The cap is high, and sometimes on a Monday in winter we will hit it. But as we find that the further we go into triage, the more our patients know that they will get an appointment, and because we've fully met that unmet need, it's just really settled down. Our routine, we have our cap, so we're 9,000 patients. For medical requests, our cap is set at 140. How far in advance? So we do all total triage. So a 2-week appointment is the furthest in advance that is available. We have follow-up slots as well, that the clinicians can book their own follow-ups or other people's follow-ups. It is the job of the triaging doctor is otherwise the gatekeeper of the appointments. We've started doing on a Monday, we have a second, so normally it's just one clinician, mainly docs. We have got one advanced nurse practitioner who does triage as well. But on a Monday, we have two triaging in the morning. The first bit of the clinic, the second doctor deals with all the triages that don't need an appointment, just to try and clear off a whole of that work. And then they do a see and treat clinic. So it's those quick and easy, I've got a lump, I've got earache, those things that don't require, we're 15-minute appointments, things that don't require a 15-minute appointment, and we just bring them down.
Oh, thank you so much, Sarah. I think there's more questions related to the cap, and yeah, like what you're gonna do after the new contract takes place.
Is the cap, you can set up the cap.
Yeah, I can show you how it looks like
You can set
afterwards.
that up through, you can split admin and medical, and you can set that up in the settings. Are we planning to remove the cap with the new contract? This is a really interesting one that I'm actually interested to hear the BMA's take on, when you're looking at safe working guidelines, and also the fact that what they're asking us for is to have online availability for non-urgent appointments. So we still need to have a conversation, and I'm interested to hear what the BMA is saying about how we clarify with the patient what a non-urgent appointment actually means. As I say, it is in winter, occasionally on a Monday, that we hit our cap. It is not a common occurrence. And with our cap, if we hit it, we will close for 30 minutes and then reassess and often reopen to it once we are aware of our appointment capacity and our availability. But I'm interested to see what the BMA say about, because we can't go to unsafe levels of care.
Yeah. No, I agree. And sorry, there's actually more questions. Keep them coming because it's really, really good as well. Hope you don't mind as well, Zara.
That's fine.
Like I'm just asking questions. I have other questions as well, but yeah, I can see there's questions about how many CN tweets can you have on a Monday, for instance.
Oh, it's just so we have the equivalent of 4 book on the days, which most people will therefore normally do 8 or so see and treats. It really depends, but they might, while they're triaging, we really encourage, if you can deal with it in triage, you deal with it in triage. So here is a photo of my psoriasis. It is worse. Please, can I have to Anacon, you know, whatever it is, we try and deal with, and we try and encourage people to deal with as they go, just for effectiveness and efficiency. Obviously, if a patient is asking for a face-to-face, so I'll normally text back and just say, are you happy that I deal with this remotely? If you're not and you'd like an appointment, please let us know, just so that you're always giving the patient the choice.
Yeah, absolutely. You know, that's such a good idea. Actually, definitely, I've heard that from other practices as well. I was wondering if there's anything that you would do differently looking back on the way that things were implemented. Yeah, any big advices, like do or don'ts, that you could share as well.
This isn't like, I love total triage, but if you are not well enough staffed, this is not going to solve your staffing issue.
Yeah.
So you've got to, you know, if you just don't have enough doctors, this is going to help you get, what's this going to help you with? This is going to help you get away from the 8 o'clock rush, and it's going to help you see the right people in the right time frame. And but it's not going to, as it settles over time, your demand does go down because patients settle into it and they know they're going to get seen and things do get dealt with. But it's not going to, I think it's just it's really important to think this is not going to solve, you know, if you're a practice of our list size with our demographics and you've only got one doctor in on the day of the week, that's, you know, you're not going to win.
Yeah.
So
Yeah, and there's another question in the chat asking how many GP partners you have in your practice.
so we're 4
Oh,
partners and 4 salaries, but
amazing.
none of
Thank you.
us, the most number of sessions, and people work between 4 and 7 sessions. So when you say enough GPs, how many working time equivalents? We have 48 sessions a week. But I think it really does depend on, but in that we will also have partner management session, we'll have minor ops clinics, we will have diabetic clinics, we'll have coral clinics, etc. And we're 9,100 just over. I think it's also really important to state that there's a practice around the corner that's only got 3,000 patients less than us. And yet they only have 2 clinicians on a day and their access is still good. So it really depends, because they're on an estate where there are loads of families, whereas we've got an elderly population. So we're going to need more appointments. So I think the demographics of your patients is also really important to factor into this.
That's really helpful. Thank you. And so I'm quite conscious that I'm going to check, because I'm not sure if Dr. Adam Cliff is also in the call, but I'm keen to also have him share a bit more about his experience as well. But I have actually one last question for you, Zara. It's about, so you talked about some of the benefits that you had in implementing total triage. I was wondering if there are any other benefits you'd like to share, like efficiency, anything you wouldn't necessarily think about when you're thinking about implementing total triage and a patient triage solution, for instance, but you actually got to be like, oh, wow, this is actually great.
I love that I know why every patient now walks in the room. So I have a whole triage worth of information for every patient that I call in. And to me, that just decreases the stress radically. So that's been a really good. We're also a staff, we all, well, all but one who is 9 months, 8.5 months pregnant, all of us have primary school age children at home who inevitably get sick and unwell. And so we just triage from home when our kids are unwell. We swap around, triage from home if our kids are unwell. Obviously, if they're really unwell, it's a bit different. So therefore, there's just so much more flexibility in how you can run your surgery or run your system. And so the less stress, because you know why everyone's walking in the door, and the flexibility that they bring. We have, interestingly, something, Leanne, you've just put on. So Lisa, we have one person doing, we no longer have an on-call. The on-call person is the triaging clinician. So they will also deal with the paramedics, the social workers, whoever rings in. On a Monday morning, we have a second person as well. We still, interestingly, we implemented this in the March, and suddenly thought, okay, yeah, our acute care and access is now really good. So in the July, for the July, we completely 23, we completely overhauled all our chronic disease system to involve Accurx and a more streamlined system. And have seen our quaff go up, but that's a whole nother conversation. But I'd happily have it, Leanne, if you wanted to get in touch.
Yeah, and that's a perfect segue into what I was about to say. If you have more questions and you'd love to learn about more about how Zara and her practice implemented Accurx and our triage solution, what you can do is always book a call with Zara. So if you can see my slides over here, I have a QR code. You can scan that QR code to book an ambassador call with Zara, and she'll happily help you with any of the questions you might have. And also, it will be like a much smaller group session, and it can be a bit more bespoke as well. I'm sure, Zara, you can share a bit more about those sessions as well. But yeah, that's your opportunity, I would say. Just go
Yeah,
ahead and
or
make sure you
come.
book those calls.
I'm speaking at the Accurate conference in London, so come.
Yes, yes. In April, oh my gosh, cannot believe it's already like literally tomorrow. But yeah, no, like there's plenty of opportunities for you to ask more questions and also, yeah, make sure that you get the advice and support you need to. I'm going to share more about that afterwards. As I said, we also have Dr. Adam Clave in the call. So I'm going to check, sorry, if he's in the call. So you can hear a bit more about his experience. I'm not sure if he's here yet. Adam, can you hear us? I don't think so. So if Dr. Adam Cliff is not here, what I'm going to do is I'm going to go ahead and share a bit more about Accurx and the triage solution so you know how you can go ahead and use that, how it's going to look like for your patients. And also, I know that Zara mentioned some of the features like the capping and the settings. So what I'm going to be doing now is just move to my demo environment over here, and I'm going to go ahead and share, yeah, as I said, how it looks like for you as a practice and your patients. Yeah, I was wondering if actually any of you had a try at Accurx and how it looks like. I'm assuming most of you have already used SMS. But have you had a try of like having a look at how it looks like for you? You can leave it in the chat if you had a try or not. I'm just quite curious to know how familiar you are with these tools. No, I'm guessing none of you. Okay, so I'm going to go ahead and start by going into my Accurx toolbar, and I'm going to go ahead and click on my initials and then the patient triage option, the second one after my name. You can go ahead and follow me as well. If you have your computer open, you should be able to see the same things that I have right now. When I go into my patient triage option in my toolbar, it takes me to this page. And basically, this is where you need to go to deal with anything that has to do with patient triage. And as you can see here, I'm in my settings page. I'm going to go more into that afterwards. The first thing that I'm going to do is actually go into my left column over here under patient triage and select what is patient triage. When I do so, it takes me to this page where it explains simply what patient triage is. And the reason why I'm here is I have this button over here, which is saying create a patient triage request to see how it works. And that's what I would encourage you to do. Like you can go ahead and test it with your own test patients to see how it looks like if you were a patient. So I'm in my own demo environment, so you're gonna see like very like funny names, but over here essentially what you're gonna have is the practice name and address to make sure that the patient knows they are submitting the request to the right practice. And then you have this yellow box over here. So this is what the patients can read before they go ahead and submit a request. And this is something that you can customize, in particular the bit that I've just highlighted over here. This is really important because this will help you set expectations with your patients and make sure that you're managing them as well by letting them know, for instance, how many working days it will take your practice to get back to them once a request is submitted. And you can add more information depending again on your patient demographics and your patient's or practice needs. And then as you can see here, we do have quite a few options in the form, which is great. Patients can go ahead and use it to submit an admin query. As you can see here, it can be for sick note, test results, or anything that is admin related. They can also go ahead and submit a medical issue query. We're going to go more into that in a few moments. They can also come into this form to seek online advice. And if they click this option over here, they're going to be directed to the NHS.uk website. They're not going to be asked any further questions. They can just search for anything they'd like. And then we have one last option over here where essentially patients can self-refer themselves to any local services. And I'm going to briefly click here so you can see. So it's very short right now, but basically this is your own space to put any local services like a sexual health clinic, as you can see here, physiotherapy, mental health services, anything you think would be beneficial for your patients to know that they can refer themselves to. And basically they won't need to get in touch with the practice via the phone to get these details. And then the last thing that we have here is the option to log into this form with the NHS login details. So it basically simplifies the form for the patients as they won't be asked for any personal details. That will all be pulled from the NHS app. But also if they have the NHS app installed, they can go through the app to access this form and submit the request. They don't need to go through your practice website to initiate contact. What I'm going to do now is I'm going to go through this second option over here, the medical request issue. And as you can see, whenever I'm submitting a request via this form, always going to have this red flag symptoms page. So as a patient, I need to acknowledge that I'm not experiencing any of these symptoms, and we also have different symptoms for children. Once that's done, you can click over here to confirm that I'm not experiencing any of these details, symptoms. And then after that, I'm taken to the bulk of the medical form. So this is essentially all of the questions that I'm going to be asked about my medical issue. Some of the questions are compulsory. Some other questions are optional. So over here, for instance, the first one is asking me to describe my medical problem. So I'm going to put down, for instance, that I have a rash on my finger. And as I'm writing here in this free text box, I can see that the character limit that I have below it is decreasing. So we encourage patients to be like quite explanatory, of course, to share details with you, but also be quite concise when doing so. And I can also go ahead and attach a photo. So let's say over here, I just need to acknowledge these 3 points, for instance, that the fact that my photo might be seen by staff of all genders, for instance, or it may also be saved to the record. So I need to agree with that by checking this box over here before clicking continue. And then I'm just giving tips on how to take a good photo. And once that's done, I can go ahead and upload my image. So I'm going to choose this one, for instance, click continue, and then I'm taken back to the form. And as you can see here, I can add up to 5 images if I need to. Then I can move to the second question, which is asking me how long have these symptoms have been going on and if it's getting better or worse. So I'm going to put down 2 weeks, for instance. Oops. And I'm just going to be quite brief for today's demo. But again, I imagine that your patients would be sharing a bit more. Again, as you can see, I have my character limit, and then I have my third question asking me if I've tried anything in particular. So let's say for this one, I've tried a cream. Then we have the first optional question of the form asking me if I'm particularly worried about anything. And as you can see in the example, if I'm worried about how this is affecting my daily life, my work, for instance, this is the box where I can go ahead and share a bit more about that. Again, you don't have to do that, but it's great because it means that you have all of the context and information you need to triage these requests effectively. And then we have the last compulsory question of the form, which is asking me as a patient how I'd like to be helped. So again, this is quite helpful if you have patients who want to have a face-to-face appointment or a new medication or anything like that. This is where they can go ahead and express it. So for instance, again, I'm going to be quite brief for today's demo, but as you can see, I can just write down anything I need, and then I have my last question. So this one, I know this can be really helpful, especially if you have anyone from your admin or reception team contacting patients. This is great because we ask the patients when is the best time to contact them. Again, it's optional, but I'm going to go ahead and put down after 5 p.m. on weekdays, for instance. And then once that's done, I can go ahead and click continue. I'm taken to this question where I'm asked if this is for myself as a patient and the person who's filling out this form, or if it's for someone else. This option is really helpful for parents and carers. And basically, the difference between these two is that if it's for someone else, you're going to be asked for the details of the person who's filling out the form and then the details of the person who's experiencing the medical issue. I'm going to keep it for myself to keep it simple for us. And once that's done, I'm taken to this page where I'm asked for my own personal details. So I'm just going to put my test patient's details over here. As you can see, it's still quite simple. We just want to make sure that we have some patient information. But as Zara has said, there's no login required or anything like that. And if patients already have the NHS app, all of these fields are already pre-filled for them. So they just have to confirm. And then I would say over here as well, we ask them how they'd like to be contacted. So let's say I can choose both of these options, text message, a phone call. And then we have one very important question over here, which is asking the patient if they have access to their phone right now, because we need to verify their identity. What's going to happen if I click yes, I'm going to be sent a code to my phone number, and I'm asked to put the code back into this Accurx page. And in the background, what's going to happen is that these medical requests will be linked to my patient's record through PDS. So when it comes to the practice, it's already mapped to the record. You just need to confirm the patient identity and proceed with the triage. But as you can see here, the patients also have the option to skip this question, meaning that we're not going to be verifying their identity and meaning that the request won't be matched to the patient record. But it's quite straightforward for you as a practice to do so. So I'm gonna keep it to this option, and I'm gonna show you how it looks like through the practice when it's not matched to the patient record. So I'm gonna click continue. Oop, maybe I put too many sevens. Amazing. And then this is basically the last step before submission. I just need to review my request, make sure that I'm happy with all of the questions and answers. And then I have one last optional question asking me if I'd like to speak to someone in particular. This is really helpful if you had a patient with an ongoing medical issue and they want to make sure that they're seeing the same clinician for continuity of care. This is their option to go ahead and put down the name of the clinician in this box, for instance. We do give the patients a caveat though. We do say that your practice will try the best to fulfill their wishes, but it might not always be possible to do so. So yeah, once that's done, as a patient, all I need to do is submit a request, and then I'm taken to this confirmation page over here. And again, we do have some bits of information for the patients so that again, we help with managing of expectations. And these text over here, what I've just highlighted, is something that you can go ahead and change in the settings, customize your own practice and adapt again to your patient's needs as well. So yeah, I hope this has been quite straightforward and clear so far. I'm just going to stop for 1 second. I just want to check if you have any questions about this. If you do, feel free to put them into the chat. I'm just going to have a look right now. Amazing. I can see that there has been some questions for Zara as well. Amazing. So there's one question. Oh, I don't think that's for me. But yeah, otherwise, if you don't have any questions, what I'm going to do is proceed to the next step, which is showing you how it looks like when it comes to your Accurx inbox. Again, I'm assuming that you're already familiar with the inbox, but I think there's a few things that really good for you to know when you are triaging with the Accurx inbox. So what I'm going to do is click in this first icon over here next to my initials, and it opens my Accurx inbox. And one thing that's really important for you to know is that all of the Accurx triage requests go into one folder in your inbox. So again, you have one big overview of all of the demands. It goes into the unassigned folder over here. And when you click into this unassigned folder, you also have two subfolders that will allow you to filter the requests. So you have the admin filter over here where you can see all of the admin requests. And also you have the medical filter over here where you can see all of the medical requests. At the moment, I'm happy to have both of them. And one other thing that's really important, especially as you're thinking of implementing patient triage, is once you know who's going to be managing the triage requests, you need to make sure that they have the notifications switched on for that unassigned folder to make sure that no request is left unseen and treated. So you just need to make sure that everyone has these switched on basically. And if they do, they should be able to see the red dots like I do right now. The other thing that we also have here, so at the moment I only have two requests. And as you can see here, the most recent one is always at the top and the oldest one is at the bottom. But that's something that you're going to be able to change very soon as we're going to be implementing a sorter where you can change the order in which the request appears in specific folders. So again, yeah, keep an eye out for any new updates from Accurx. So yeah, and then what I'm going to do is actually I'm going to click on this request. I can see that this is the one that I've just submitted with you here today. If you look at this request, it's written patient not found at the top. And there's not much I can do with this request. I can view it. And that's because when I was submitting it as a patient, I didn't do the verification step. So as I said, my request has not been matched to my record. So what I can do as a practice, if it ever happens, is I can click here and search for patient. And I already have some patient details over here. So I can put the patient details over here and start looking for my patient. One thing that's quite nice as well is because I already have the patient details over here, it's already suggesting me a patient as well. But I'm going to go ahead, for instance, just put down again my test patient's details over here, click search. And when it's the case, again, it already you can have a different list, of course. But if you do, you can go ahead and select the one that you think is most appropriate. In this specific case, I'm going to select my own test patient, confirm that I want to match the request to my patient's record. And once it's done, if you look over here, I already have my test patient details at the top. And at the bottom, again, I do have a clear audit trail of anything that has been done with this request. And now I do have options as well. I can start actually interacting. So I can either save to the record, I can preview the attachment as well. I can go ahead and reply to my patient. And again, if you're already familiar with SMS and questionnaires, it's exactly the same thing that you can do. You can go ahead and just write a text message, use, let's say, a template. I'm not going to go too much into that right now. You can also use a self-book, which again, I know Zara will refer to these. This is quite helpful. So you just click and you can send a self-book invite to invite the patient to book into an appointment. Again, I'm not going to go too much into these now, but I'm more than happy to share more about it afterwards. The other thing that I would say is quite helpful is adding a note. This is really helpful because it helps with collaboration and visibility, and it's all under the same request, so you're not jumping between systems. So you can write anything you'd like to in a note. This won't be visible by patients, and it can only be seen by people at your practice. So if you add a note, it will be in the patient conversation over here, and it will be visible over here as well. And the other thing that again is quite helpful is the option to assign. So let's say you don't want to be working from the same folder and you know that there's a team in particular or someone in particular in your practice who can deal with this request. What you can do is either assign to a colleague, so I can assign to my colleague Kat over here, or I can also assign it to a team. So let's say the doctor's team. And when I'm assigning, I can also write down a note and then click assign. And I have a confirmation here. I know that it has been sent to the doctor's team. And I can go here in my Teams folder, click and select the doctor's team to view my requests. And again, I have the notification switch on for this one. That's why I have notification. So again, this is really important. Make sure that everyone has the notification switch on for the folders they need to check. And again, it has been assigned and I have a clear audit trail of anything that has been done. The other thing as well is, let's say I'm looking at this request and I realize that it's actually quite like urgent, what you can do is go to the top over here and mark as urgent. And when you do so, we add a red flag, and this request stays at the top. Basically, even if you have other requests coming through, this one will stay at the top because it's urgent, and will only go back to being a normal request and not being at the top. When you choose to mark it as not urgent, we remove the red flag over here, and you can just go ahead and interact. The other thing that I find quite helpful, and I know that certain practices don't use it yet, but I would highly recommend, is making sure that once a request has been treated and you don't need to take any further action, what you can do is make sure that you mark it as unread. And when you do so, sorry, mark it as done, not unread. So this is another function. You can do that if you want to go back to the request. But if you want to mark it as done, you just need to click it over here and it removes it from the list. You can also go ahead and select an outcome. So let's say I've invited this patient to a face-to-face appointment. I can click face-to-face and choose to save it to the record as well, as you can see. And then over here, I'll know that anything that is left are requests or conversations that need to be dealt with or need actioning, basically. So yeah, I'm quite conscious that I've shared a lot. There's one last thing that I think is quite helpful. And again, I know that Azara mentioned it. It's really helpful, especially if the form is closed, or again, if you have patients who cannot go online themselves and submit a request. What I strongly encourage you to do is actually use what we call the reception flow. So, what you can see over here to submit a request on behalf of those patients. For these options to be available for you, all you need to do is make sure that you have a patient open in your system. So you can see I already have my test patient open in the system. So I have this option to submit a new triage request on their behalf. So I just need to click here and it opens my web page. And it's a page that's quite similar to what patients can see online. I already have my patient information over here, and I just have to select the type of request I want to submit on their behalf. I'm not going to go through all of it because it's basically the same form that patients can see online. We want to make sure that we are collecting standardized information so you can make an informed decision once it all goes through the unassigned folder and you know which requests need to be prioritized, for instance. But yeah, and as I said, any request submitted via this flow will be going to the unassigned folder in the inbox unless you choose to yeah, assign it to another folder, which is an option you have at the end. So I'm not going to go through all of it now. And I'm going to make sure I'm stopping for questions because I can see a few questions in the chat. So yeah, feel free to share the questions right now in the chat. I'm actually going to go ahead back to my slides as well. So yeah. So I have a question from Karen. When patients put a request through a proxy for another patient, it always sends a message to the patient. Can these prevent it? Can this be prevented? Sometimes it's not appropriate to let the patient know that someone has contacted the GP about them. So I'm not sure if that's actually something we can do. I know that for safety and security purposes, that's why it's actually implemented. If a request is submitted on behalf of a patient, we send a message to let the patient know a request has been submitted on their behalf. So yeah, I can see that my colleague Key has actually replied to this thing, to this piece of feedback. But yeah, I'm gonna make sure I still share this with the team, but I'm not sure that it's something that we can implement right away. Um, so yeah, and then I can see there's more questions for Zara, which is really good. Thank you so much for all of your questions. Um, so yeah, I can see that there's quite a few questions that have been answered by my team. So I'm just gonna check if there's other questions um, that you might have that I'm happy to take live. Oh, okay. That's actually such a good question, Caitlin. Thank you so much. So Caitlin has said, I was asked essentially if there's any new features coming for this triage system, because we haven't had any changes in the last, let's say maybe last year. And yes, actually there's a reason why we haven't had any big changes in the last year. It's because we've been planning all of the changes that are happening this year. So I can see if I can share this with you quickly. We do have a product roadmap for you to check. So if I cannot find it now, I'm going to make sure I share it in the follow-up. Because basically, as I said, we haven't done a lot of changes. I mean, you've seen the inbox has changed, for instance, but there's more and more changes coming to the solution that you have access right now, especially for the triage function. So I'm going to go ahead and just share this with you. So I have a document as well for you. So I'm going to share a link, and then I can also share the document as well, but you should be able to access the link right now. So I'm going to put it on the chat. Oh, amazing. Thank you, Kes. So Kes has also like shared it. But you can see all of the changes that we have coming up this year, which are a lot. So yeah, any other questions, anything you'd like me to share? Oh, amazing. Thank you so much, Dilesh. So, right now, I cannot promise we're going to have other sessions like these, but actually, this your question is really good because what we do have available is actually other sessions where you can come and just ask any questions. In particular, I would say bespoke sessions where you can come with particular questions about your practice and how you'd like to implement these tools, and we can go ahead and yeah, give you a bit more of a bespoke advice. I would strongly encourage you to book a one-on-one call with us, especially to go through the settings. As I said, there's quite a few things you can customize with Patient Triage, and the reason why I haven't shown the settings here is because it can really depend from one practice to another, depending on what you want to do. So it would be best for you to book a session with us, and myself and my team would be more than happy to take you through the settings page, and again, like recommend things depending on what you want to do with this triage solution. The other thing, as you can see here, if you scan the second QR code over here, you can book calls with our Accurx ambassadors. They are healthcare professionals like yourselves who have gone ahead and implemented triage before. So I think it was just beneficial for you to go ahead and join these ambassador sessions. As you've seen here today, we've had Zara, who very kindly shared a bit more about her experience. And as I said before, if you want to go ahead and ask more questions and learn from others who have implemented it before, you can go ahead and book the session. I want to say you don't have anything to lose by joining these sessions. So yeah, and also, I'm more than happy to share the other slides, but before I go ahead and leave the slides I've just shared, I want to make sure that you also don't miss out on these. We do have a community of healthcare professionals like yourselves who are using Accurx, and I would strongly encourage you to join our community platforms, either Facebook or WhatsApp. It's a great, I would say, opportunity for you to ask any questions that are about Accurx, to view how other people are using Accurx, whether they're using questionnaires or specific custom questionnaires. I know there was a question about QOF, and I know we also had a webinar on QOF last week that was led by our amazing colleague that we have here, Kat. So if you want to share a bit more about that, Kat, as well on the chat, you can go ahead and share that. But I would say just yeah, you don't have anything to lose by joining either our ambassador sessions or one-on-one calls, and also our community platforms to ask about Accurx, learn about how other people use Accurx, and even be one of the first ones to hear about our community events. As I said, we're going to have our Accurx Connects uh, event last month, next month, which is again, I cannot believe is actually like happening next month already. You can go ahead and make sure that you join the community platforms to hear about it. So yeah, and yeah, I'm gonna go ahead and take more questions, but I'm gonna leave it on these slides so you can go ahead and scan if you haven't had the time to do it. But yeah, and yeah, I'm gonna make sure I share the QuAF webinar if you're keen on learning more about it. So yeah, do you have any other questions? Anything I can help you with? Amazing. Thank you, Cass, as well for sharing the link for the webinar. But yeah, like we do have quite a lot of sessions happening for you in terms of training and help with Accurx. So yeah, and as I said, I can share again the link to the form. But if you have any specific requests or if there's anything you feel like you need to have from us and it's not available out there, please feel free to fill out this form over here. So I'm going to share again. I'm going to share it in the chat. So yeah, we can go ahead and see what we can do to create and help you as well. Um, so yeah, so it should be in the chat again. If you don't have any other questions, I really want to thank Zara for her help today and sharing her insights and everything and just helping with all of the questions. Yeah, do you have any last words, Zara? Oh, I think you muted, Zara. I'm so sorry.
I think this is just, as I said before, it's really revolutionized how we ensure that patients get access to us and the right patients get access to us, and it has improved our continuity of care as well. So, yeah, get your system right first, get your PPG involved, and go for it. And the government will hopefully support us come October as well.
Yeah, hopefully. I mean, thank you so much because this is like again very helpful. I mean, for me, but I imagine for you. Yeah, and I also want to thank my colleagues Kat and Kes and Keith for all of the help with the questions.